Well, everybody's waiting to hear exactly what the president will have to say about health care when he addresses a joint session of Congress next Wednesday. So far, President Obama has been letting lawmakers hammer out a lot of the details while he sort of stays above the fray. But now he's going to have to get a lot more specific about which details he believes the plan must include and whether he's willing to scrap some of the more controversial elements that are standing in the way of making a deal. Let's debate it with Doug Heye, a former communications director for Republican leader Michael Steele. Also with us, Fox News political analyst Kirsten Powers. She writes a column for the New York Post. Douglas, this president is a very good speech maker. Could this be what he needs to turn the tide?
You know, it's funny, John. Anytime the White House seems to be in trouble, they suggest to put Barack Obama out to give a speech. There's certainly a short-term benefit that can come from it. But the president needs to be very clear and consistent on what he wants, what this will cost, and how it will affect health care. Voters need to know that this isn't just a make-it-up-as-you-go-along strategy shift. And really where we see the lack of clarity is with the public option. It seems to be that the White House is playing a hokey-pokey here. They put the public option in, they take the public option out. Voters really need to know what the president wants to do.
Public option is basically government-run health insurance. Kirsten, would you be surprised if it gets jettisoned? I mean, Nancy Pelosi has said it's going to be in there.
No, I wouldn't be surprised at all, actually. And I think that the White House, from the very beginning, almost knew that this was going to be controversial, and which is why they put out other ideas such as some sort of health care exchange. I think that they've been flexible on it. Now, Nancy Pelosi might not be flexible on it, but they're going to want to get some sort of bill passed, and if they can't get it done with the public option, then the public option will go. Because I can guarantee you, something's going to pass. It's just going to be a question of whether it's something meaningful or something that's just for show.
Well, Doug, what's your take? If the public option, which has really alienated a lot of conservative lawmakers, if that gets jettisoned, if the president says, I'm willing to, go for some kind of health insurance reform without public option, is that going to get enough Republicans on board that this thing could pass?
Well, the real concern is that it may not get enough Democrats. You look at the Blue Dogs, Larry Kissel, who's a freshman from North Carolina, Tom Perriello, who's a freshman from Virginia. These are members that need to be convinced by the administration that are Democrats before they can even think about Republicans coming on board. And it's a real challenge. You've seen independents and seniors really coming against this plan. Even the left is upset with it. It's why you're seeing Barack Obama's poll numbers dropping faster than prices in a Walmart ad. Yeah. It should be troubling for the administration.
Kirsten, let me read you a couple of quotes from from a Washington Post article today, fairly left-leaning newspaper. They're writing things like, it's an attempt to regain the initiative in the health care debate. The White House is scrambling to take control. It sounds like the perception out there is that this president has sort of, dug himself into a hole and needs to climb back out.
I think that would be a fair assessment of the situation. I don't think that they've handled this properly, and they thought that they would do the opposite of what Bill Clinton did, rather than giving a bill, that they would let Congress do it, and that somehow that would work out better. But even if they had done that, I just think the fact that they have not been clear about what they want, and I have to agree with what Doug said, is that, do they want the public option? Do they not want the public option? I mean, that's why the left is upset. That it's, sometimes it's like, it's so important and it's the only way we're going to control costs. And then other times it's like, it's just this tiny little sliver and maybe it doesn't matter.
But very quickly, Doug has said the president's gone to the well too many times with the speech making. Does he run the risk of just losing the match?
He doesn't have a choice. At this point, he has to do something.
Kirsten Powers, Doug Heye.
Okay.
Thank you both.
Thanks.
Thank you.